Glomerulonephritis and pyelonephritis are both types of kidney inflammation, but they affect different parts of the kidney and have distinct causes, symptoms, and treatment protocols. Below is a detailed overview of each condition, including their etiology, symptoms, diagnosis, and treatment options along with dosages. Glomerulonephritis refers to inflammation of the glomeruli, the tiny filters in the kidneys. The etiology can include 1. Infections, post-streptococcal glomerulonephritis, following a streptococcal throat infection. 2. Autoimmune diseases, conditions such as lupus or Goodpasture syndrome can lead to glomerular inflammation. 3. Vascular disorders, conditions like vasculitis, for example, granulomatosis with polyangiitis. 4. Drugs and toxins, certain medications like NSAIDs and toxic substances can cause glomerular damage. 5. Systemic diseases, conditions like diabetes and hypertension can lead to chronic glomerulonephritis. Symptoms may vary, but common ones include 1. Hematuria, blood in urine which may appear pink or cola-colored. 2. Proteinuria, excess protein in urine leading to foamy urine. 3. Edema, swelling in the face, hands, feet, or abdomen. 4. Hypertension, high blood pressure. 5. Reduced urine output, oliguria or anuria in severe cases. 6. Fatigue, general malaise, and weakness. Diagnosis usually involves 1. Medical history and physical exam, assessment of symptoms and health history. 2. Laboratory tests, urinalysis, to check for hematuria and proteinuria. Blood tests, to measure kidney function like creatinine and BUN and check for autoimmune markers. 3. Imaging studies. Ultrasound may be used to visualize kidneys. 4. Kidney biopsy, to obtain tissue samples for histological examination and definitive diagnosis. Treatment depends on the underlying cause, but may include 1. Corticosteroids to reduce inflammation. For example, prednisone at 0.5 to 1 mg per kilogram per day, tapered based on response. 2. Immunosuppressants for autoimmune causes. Cyclophosphamide at 1 to 2 mg per kilogram per day, or 500 mg per square meter intravenously every month. 3. Antihypertensives to control blood pressure. Angiotensin-converting enzyme inhibitors such as lisinopril at 5 to 40 mg orally once daily. 4. Diuretics to manage edema. Furosemide at 20 to 80 mg orally once or twice daily. And 5. Dietary modifications. A low-sodium, low-protein diet may be recommended depending on kidney function. Pyelonephritis is a bacterial infection of the kidney, often originating from a urinary tract infection. Its etiology includes 1. Bacterial infections, most commonly caused by E. coli. 2. Obstruction. Kidney stones or structural abnormalities can predispose to infection. 3. Vesicoureteral reflux, which is the abnormal flow of urine from the bladder back into the ureters. And 4. Catheterization. There is an increased risk in patients with urinary catheters. Symptoms of pyelonephritis may include 1. Fever and chills, often presenting as a high fever. 2. Flank pain, which is pain in the back or side, typically on the affected side. 3. Dysuria, or painful urination. 4. Increased urinary frequency and urgency. 5. Nausea and vomiting, which may occur in severe cases. And 6. General malaise, feeling unwell or fatigued. Diagnosis typically involves a few key steps. First, a medical history and physical exam are conducted to assess symptoms. Next, laboratory tests are performed. Urinalysis is used to check for white blood cells, bacteria, and nitrites. A urine culture helps to identify the causative organism. Blood tests are also done to evaluate kidney function and signs of infection. Finally, imaging studies like ultrasound or a CT scan may be used to detect complications or obstructions. Treatment usually involves antibiotics and supportive care. Antibiotics are often initiated empirically based on the severity of the condition. Ciprofloxacin, 500 mg orally twice daily for 7 to 14 days, is one option. Trimethoprim sulfamethoxazole, 160-800 mg orally twice daily for 7 to 14 days, is another. Amoxicillin, 500 mg orally 3 times daily for 7 to 14 days, can be used if the bacteria are susceptible. Analgesics are prescribed to manage pain with acetaminophen 500 to 1,000 milligrams orally every 6 hours as needed, being a common choice. Hydration is encouraged to help flush the urinary tract. In cases of obstruction or recurrent infections, surgical intervention may be necessary. Both glomerulonephritis and pyelonephritis require careful diagnosis and individualized treatment strategies. Early detection and management can prevent complications and improve outcomes. If you suspect kidney issues, it is crucial to seek medical attention promptly. Thanks for watching. Like, share, and subscribe.